time I want to share something I read in Daily Guideposts with you all before the prayer. It comes from Ephesians 4:32. It says, "Be kind to one another, tender-hearted, forgiving one another as God in Christ forgave you." With all the excitement and the judgment people are placing on one another, maybe those words might temper some of our thinking. Y'all will join me in prayer, please. Father God, we come together today, having been in your house, many of us yesterday, and in the various houses of our Lord as we look to celebrate and pray to. Father, we ask that you look down upon these troubled times that we're facing, whether it be the pandemic, whether it be civil unrest, whether it be ill feelings towards one another. Forgive us of those and help us to forgive each other. Guide us and let us be the person that you created. And let us follow in your Son's path and seek a better life. It's in Jesus' name we pray. Amen.
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 Thank you. Join me in pledge of allegiance, please.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Now the Texas flag, please.
Honor the Texas flag. I pledge allegiance to thee, Texas, one state, under God, one and indivisible.
Take your seats, please. At this time, I'd ask if there are any public comments by anyone about this. Hearing none, we'll move on. Ask the court to take action on the consent agenda item, and which one, Mr. Beecham, you want to move down?
Yes, Judge, if you would, please move item number 4 to general business.
All right, sir. Any other changes or clarifications? Okay, I have a motion now?
Motion with that amendment.
Yes, sir.
Second.
And Judge, I did have just clarification.
Yes, sir.
And I guess I didn't notice what Mark's saying on 4, but Willie, I don't understand I'd mark 3 here as that unanticipated revenue. Is that just loan monies coming in?
Yes, sir.
That's, okay, it's not the sale of an asset, it's loan monies coming in to purchase an asset.
Yeah, if I may, Jeff, on that is just, we received the proceeds to pay for those originally, and that, so we have to show that as revenue and expenses
Okay,
for accounting purposes.
Okay.
That's what that is.
okay, gotcha.
It's the same thing with 3 and 4.
Correct.
And the, on item 5, the taser, are we into a program? Do we have a 3-year program? Do you know, Pep, what's the?
Yes, sir. If the taser's bought with those monies, when we pay for the warranty, if those tasers were to break, those specific
okay.
ones, we could send them back. They'll send us a new one for free, and they provide us a certain amount of power magazines, which is the battery.
Okay.
for it. So,
Okay. That's
it
what
works out
I'm.
well because those handles are expensive.
Sure, you bet.
Chief, along that line, Joyce pulled together the various emails, and I'll give it to you. You can sit down, might be easier to sit down and talk it through, and then get constables in on that. So we're getting everything within standard. Okay, anything additional? Okay, we have a motion by Commissioner Beecham, and a second by Commissioner Harvey to approve the consent agenda with the movement of item number 4 to general business. All in favor, signify by saying aye.
Aye.
Opposed, same sign, motion carries 5-0. Okay.
Can we just put a little shout out for item number 10? That county tax assessor collector is really doing, in my opinion, a good job helping the citizens of this county by taking out a bunch of roadblocks. And this is just an example of how he's, I want to say, serving our public.
Well, he's helping those dealerships, especially in these COVID times.
Absolutely.
I mean, he's tried working with dirt dealers and all that.
Well, he-
Still
we know.
trying to get, but that's a lot for the dealership to take on. Patterson's have been doing it for quite some time, but it's really a good move on his part.
It is a good move, and I just think he ought to be recognized for doing that.
Yeah, I agree.
Speeds the process up and takes a bunch of load
Sure
off
does.
the
A
office
lot
here.
of
Opens it up to
demand.
the general
off of us.
public.
Okay. Okay. Listen, Mr. Beecham has some clarification he wants to make on item CA4 that we're moving down to general.
Yes, my reason for moving it is I have a potential conflict of interest with item 4 as I serve on the board of Postdale Credit Union, so I will be recusing myself from the vote.
Thanks, sir.
Motion to approve, Judge.
Second.
Any other discussion on this item? We've had more like it. Okay, all in favor, signify by saying aye.
Aye.
Opposed, same sign. And one abstention. Okay, item number 1 is to review and approve the regular bills for payment.
So moved, Judge. We went over them Friday, and
Second.
just like Barry always says, sure wish there was less of them.
Yeah. Just like home.
I did talk to Mr. Burgoyne about the flags. And
Hope you did.
Those two, yes.
Okay.
You asked a good question, and they last about, he's saying 6 to 8 years. They fly them 7 days a week, 24 hours a day. They're lighted.
Yeah.
And,
Now, what are these, Judge?
Those flags,
Yes, Texas flags that were $75 a piece.
well, the U.S. flag was 60, and the Texas flag was 75,
Well,
from the same place, same size
I
flag.
had that just as
I just
a
go to show
note,
you.
my comment, I'm not getting 4 months out of a flag. How can they last for years?
Institutional quality.
Is
You
that
have about
what it is?
correctional grade flags.
Right.
What are they, correctional
Yeah.
grade?
No,
It's a joke, Jeff.
there is a lot of difference.
Yeah, there are some that
Well,
are more permanent than others.
So
the ink
Lee's,
and
he's
all
buying
that.
them himself, he's not going through, see, because I called the auditor's office, but we're burning them up like crazy. And I'm used to that because we used to fly them out yonder it, and we'd burn them up pretty regular, but I must be getting the wrong kind
You're
then.
not supposed to burn them until they touch the ground.
No, I mean, ripping them up like after that windstorm,
They shred pretty easy.
oh.
And I'm probably not the only one sitting here, that bothers me when I see one that's unkept. I
Well,
really
yeah, people
don't
start
like that.
commenting on it,
Yeah.
and that's what they did, and we didn't have any spares, we've just been getting them, but they only last me 6 months at the most.
Yeah, I hate to see one that's,
But I can't
It's
believe
messed
I'm
up.
paying less than $50, $60 for what I'm buying. I mean, I'll double check into that.
Check with him on who he's getting them
Yeah,
from.
that's a good
Carrot
idea.
top.
Carrot Top on the internet.
Oh, Carrot Top is the name of it?
Uh-huh.
Okay.
Okay. We have a motion by Commissioner Harvey, a second by Commissioner Waller. Any other comment? All in favor, signify by saying aye.
Aye.
Opposed, same sign. Motion carries 5-0. Item 2 is discuss, consider, and take action to approve the purchase of Aruba network switches, stacking modules, stacking cables, and power supplies at a cost of up to, and Mr. Crutchfield got a quote, came in late, and needs to raise that to $45,777.86. And Mr. Crutchfield, I had put down maybe to add a little bit, is there any other thing, shipping, freight, anything like that we could allow a greater number?
No, sir.
Okay, let's go ahead and make it an even 46,000. Okay, anything else you want to explain to us about that item?
Yes, sir, what we're attempting to do is prevent any potential of a bottleneck between us and the new LEC. So replacing the switch on the 4th floor where all the microwave radios terminate with a beefier system. And then the second system is actually for the LEC, the IDF2. We didn't think we were going to need one for out there so soon, but there are some jacks in the area that we've been able to occupy for the LEC that terminate in that IDF, so we need connectivity over there as well.
Okay, well, that system is, that has the options we have in it and the backup we have in it is critical, because what kind of operation goes on.
Yes, sir.
So, okay. Sidebar question, did we ever work out, I'm sure there may be more in Europe, on with the inmate phone system with Global Link? Did we ever figure out?
On which,
Well, and an extra, fiber that was being pulled on site to tie in, isn't it going into the AT&T equipment also?
I believe GTL has their own dedicated fiber. But I'll go.
Okay, but I thought we were.
And I think they're getting their fiber from AT&T as well, which would be our failover. And those work orders are into AT&T. And I think that the fiber has been ran to.
The fiber's in the building, yeah.
Okay, yeah, but it hasn't been configured yet
Okay,
for that.
but our contractor pulled both fiber points, I thought.
I think that's correct.
Glenda?
I was told that he just pulled the one ours, that GTL is not pulled theirs.
GTL is not
Yes.
pulled theirs?
Okay.
The whole, everything that's going on with that fiber is kind of confusing.
It was two separate orders, and our order was fulfilled, but their order was
Because
not yet.
they come on 2 separate days and was sent away and.
Nobody wants anybody pulling their fiber, because then if there's a problem, there's gonna be a lot of
Exactly.
pointing and,
Yeah.
you know, everything.
That's why I thought GTL was completely separate.
Okay. That's
It
good,
will be-
except they need to
It will be
understand
pulled
that.
in the same conduit,
Yeah.
that conduit that goes from south to north.
Right.
It will be pulled in the same conduit, but ours is already there and theirs still, last time I was told, was still yet to be pulled.
Okay. All right. Okay, anything else on this item?
I just have a question.
Yes, sir.
Do we have any specifics on how exactly the cost will be split on this? It says, would that be split evenly or?
No, I'll get that to you. We're, item 1 and item 9 are specifically for the courthouse. 100.412, about 5,001. And then items 2 through 8 are split evenly.
2 through 8 are split evenly?
Yes, sir.
George, do you want me to forward your email to Chris? You have it all spelled out in the email.
Oh, yes, ma'am, that'd be great.
Oh, that'd be Curtis.
Yes.
We called him Chris.
Did I say Chris?
I didn't.
We call him Chris.
From now on, we'll be Chris. Yeah.
Send it to Chris as well if you want.
Dang it.
We get Chris, Curtis, or
Yeah.
somebody. to
I make the motion to approve as stated.
Second.
Thank you. Any other comment on this item? Okay, all in favor, signify by saying aye.
Aye.
Opposed, same sign, motion carries 5-0. Item 3 is discuss, consider taking action on the installation agreement with Bryson Truck Elevator Corporation. Mr. Beecham?
Yes, Judge, this is just for the annex elevator. This does not include the elevator here at the courthouse. One thing, Glenda and Tracy for working through this contract to make sure everything is right. We do have the Craig one attached to the agenda.
We think we do.
Okay, all right.
We're gonna double check it. There've been a lot of ideations of the document. We're gonna double check that.
Okay. Yeah, there were some considerable adjustments from the original document that both Ms. Jennings and Glenda worked through. So I'd make the motion that we approve so we can get this work.
Hang on,
Okay.
I'm missing it somewhere. Where's the cost?
It's on our orders, $122,000. I thought I saw it. Yeah, click on the Tyson Group Elevator Corporation now, new installation proposal submitted August 18, 2020. And in the first paragraph, next to the last line of that paragraph says $122,000.
What page is that?
Great.
I'm sorry, I didn't see the numbers down there. I mean, while he's looking at that, Ms. Jennings, on number 3, I think they clarified it when they say they're going to retain title to the equipment, but that's until we make the last payment. I think that, because there is some prohibition there against a lien or anything like that, but this probably works around that.
There is, just in terms of their UCC filings, and whatever they do to make sure that they are gonna get paid, that's basically their remedy as far as they can tell, but yeah, it's just until the final payment.
Okay, then paragraph 4, on my copy, the purchaser and is underlined and lighter than the rest of the type. Does that mean that's taken out, or?
No, that means that was added.
Oh, okay.
It originally said, Tyson Corp shall not be liable, blah, 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 and I added purchaser in.
Okay.
But now mine's not like that, is y'all's? So that was a change that was accepted. That-
Yeah, mine
Yeah,
is
I'll forward over
underlined.
the change
Yeah, so.
that you had sent me. So that was the last change, so that's the one that got attached.
So let's talk about the added expense. It's kind of misleading to say that we're gonna spend $122,000 for a new elevator over there, when this does not include the tear out of the existing elevator equipment or shaft preparations for the new elevator. It also does not include any machine room requirements for code compliance. So how do we know up front before we start this project what it's gonna cost?
There's a whole, and y'all have approved a CMAR in applicant to do the architectural portions of the work, and that part is bid. It is not the actual elevator, the equipment itself is what this includes. It does not include the architectural features, each individual hall and floor gets renovated to accept the new elevator, the buttons, walls.
Well, I guess, Glenda, what I wanna know is how much money are we talking about spending on a total project?
I don't have that bid price yet.
Well, why would we enter into a project not knowing what it was gonna cost us? Why would we not have all of our ducks in a row and say, hey, guys, here's what we're looking at expending before we spend a dime?
You won't
'Cause once you
have
get
to
into
do
it-
this until we get the whole package put together, but I can't get the whole package put together until I have the elevator, and then once I get the elevator, then I can get the other pieces. It's like everything is a step, and I can come back to you when I get all of it, but I can't.
Would it be too late then?
You're probably looking at 2 budget years.
2 different budget years?
That was my intent on getting this in, so we could purchase the equipment on this budget year and do the actual construction during next budget year. The issue is when we originally started down this path to upgrade the elevators in the annex, we were just going to keep the same cab configuration. We discovered that it is doable to make it fully ADA compliant in the front half of the building, so thus the architectural changes that are required to put in the larger cab.
Okay, the other thing, it has a date that in September 30th, 2021, their prices will go up. We probably won't start anything on this until probably November, I think, or not, or we've made this purchase with this
Of
agreement.
2021, no, we anticipate going out to bid with the architectural portion of this work, in November 1st to December of this year, and so the work should start right after the first of the year.
Okay, but, you know, what I'm saying is they're already, we'll lose 2 months in there, so September 30th, 2021 starts their price changes.
But the contract will already be,
We'll have already purchased the equipment before then.
I agree with that.
Okay.
But what I'm saying is, if we sign this today, then this is the beginning of October, but if we're not gonna do anything until November, probably, then we're losing October and November, and so instead of having a year's time, we have 10 months before they hit us with price escalation. I mean,
once the contract's signed, there is no price escalation. It's that same, you can hold this contract in your hand until September without a price, September 2021.
okay.
Once it's signed, it's set.
So once it says we'll have the purchases done before then, so that's not likely
Yes.
to happen.
Yeah.
Okay.
This is to issue a purchase order and get the equipment purchased.
Right, so that we can get the shop drawings going, so that we can get all the information that we need to finish out the design work of the job.
Then okay, on page 5, up there where it is the team acceleration, overtime, team standard, or is a team, how many people, do you have any idea? I mean, $240 an hour, I was just curious.
I have no idea.
But in team overtime, there's more than time and a half. Because that would only be $320. I'm just curious about those.
That'd be double time the way it is here, 460 over 480.
Yeah. Well, not,
No, it wouldn't. It'd be 560.
560 would be double.
Yeah.
That's why their standards, we're finding out. I was just curious about that, that had been discussed at all.
That's for work outside the scope. What would constitute work outside the scope that we would have to bring in by some crump to do additional work?
Would that be structural or?
No,
That's what our
because
CMAR is for.
that's the architectural portions that M&F Littleton will be taking care of. I can't think of what it is unless there is when we get into that elevator shaft and start demoing it out, that there's something that we can't predict at this point.
But if you buy this equipment, you're stuck with it.
Well,
If there's something that you can't predict at this point,
No, I mean, if there's something that we have to have them come in and look at, review, or do something that's not included in this original
scope.
scope,
Well,
but I don't know what that would be. I mean, I'm trying to think outside the box. I have no idea.
all right, well,
what it would be.
correct me if I'm wrong. Here's my understanding of the project. CMAR comes in, does a demolition, and basically prepares, rebuilds the entire elevator shaft to accept this piece of equipment.
Right.
So when Thyssen Crump comes on, they'll have already discussed how that shaft gets prepared. It
Right,
should be ready to go for them to set the new equipment in and
Right.
button it up.
correct. And that's one reason why we need the shop drawings from this also, so that when
CMAR
the
can bid.
CMAR starts demoing and knows exactly where to put a plug to go back when they because elevator companies are under the same Texas Department of Licensing and Regulations. They have very specific, you will have a convenience outlet right here, and it can't be 1 inch higher or 1 inch lower, or 1 inch left or right. So there's very specifics on where they want everything based on a specific elevator. It's not just generically, it will always be in this location. Based on one elevator, it's got to be in one location. And so we need the shop drawings from the elevator that we're utilizing to know exactly where everything has to go. And that's one of the things that the CMAR had said that they're going to require of licensed companies to provide those drawings that show exactly where everything goes, so that when they start demoing it out and putting it back, that it can be exactly where it needs to be.
Okay.
And I'm misremembering, are these the contracts where it talks about when they deliver the equipment to us, and how they deliver that, but they've got to be able to deliver it, we have to make arrangements for them to be able to get the equipment into the building and all that kind of thing. So maybe that's the kind of thing they're talking about. If we get
If
a
we're not ready.
60-inch elevator and it's got a 59.5-inch door, then, I mean, I could potentially see some kind of drama about that.
How does that work? Will we pull out the front of that?
I don't know the answer to
The,
that.
yeah, the storefront will be pulled out completely, and we're looking at doing the same thing we're doing. The next storefront is replacing that entirety. When we
And
do
level
that,
that forward.
is we'll build a plywood front on it temporarily while they're building.
Mark, do we have a number that we crunched, that we guessed, pulled it out of thin air? Do we have a number? Because what I'm seeing here is this is just the equipment, execution of a separate installation agreement covered for the work described in this proposal is still required. We have to pay the CMAR to hire somebody to come in and demo. Do we have estimated numbers on this stuff, or are we just shooting from the, what are we doing?
I did do estimates a while back. I did not bring them with me. I do not remember what they were. I'm sorry, I should have, but I did not do that. I have estimated the project at one point. It's been a couple of months and
Can't remember.
I cannot remember.
But that was brought up, and Commissioner, I'm not sure whether you were here, but that was during the time we selected the CMAR. That price was covered, and was within the total amount of money we had set aside for the project.
So what was that?
I don't remember, but I remember no one had any problems with it at the time.
We think it's $500,000?
I thought it was $600,000 for all of it, for the elevators here and over
Not-
there.
No, that was the first iteration long time ago that we were talking about. We weren't doing upgrades to ADA compliance or anything. That was just doing some cab car remodels.
But this is smaller money we're spending on, in this courthouse, where he came up with the idea, and it turned out to be a good one, to be able to get that elevator all the way to the ground floor. So
Takes your ramp out, yeah.
But if you put that together with the idea that we were looking at a third elevator cost, we're back inside that, and correcting those two cars and correcting the ADA issue.
Mark, did I
Okay.
understand you to say, and now we're talking about the annex,
Right,
that we are gonna upgrade that to handicap accessible?
correct.
Is that gonna require a bigger cab and a?
It will require a bigger cab. The good part is when we started our total investigation, we found out that the shaft size is large enough to accept an ADA compliant car.
The shaft size?
The shaft
Yeah,
size.
that
There
was my
are
next
some-
question is, are we gonna run into something there where
No.
all of a sudden we don't have enough room?
No, we've had as many as 12 people at one time crawling
Okay.
in and out of that shaft, tear
Shaft
in.
size is adequate. We are going to have to lower the pit depth, and we're going to
Yeah.
have to
raise this.
open up the roof to put in the hoist beam that goes on top.
Probably needs to be upgraded anyway, so that's good. I didn't want us to run into something that,
Now Nancy's got a deal here for March 3rd?
March 2nd.
March 2nd, where it was the equipment for the courthouse and courthouse annex by the same group to be paid from permanent improvement fund and to add to the scope of work for $750,000.
That sounds about right.
And that was,
Was that just the equipment for both places?
that was the equipment, just the CAD kits and the upgrades. That was before ADA, making them all ADA compliant and replacing the cab entirely.
But there's another court action in here for the
CMAR.
rebuild
Yes.
CMR?
And the
Wait.
two,
Can you find that, Nan?
the ones that I did find that you approved for the CMR didn't have costs.
Didn't have a cost.
Okay, there's a motion by Commissioner Beach, is there a second?
Did you-
Second.
Thank you. Any other comments?
I would like to get an estimate. I just want to just know what we're looking
Did
at.
y'all put that in? Did y'all, the one that's there, do y'all did that work back whenever?
That's probably before her time.
It was before my time.
Yeah.
But I'm thinking that, yeah, Charles and Ralph did do that project.
Really, it's probably the only one that was here then.
Yeah.
So how does that work, like right now, if the elevator's ready to take someone up to the third floor and it's parked there on one, can I get under it? Can I get under that elevator? Is there
In the
a
basement.
port?
I mean, what they do is elevate, I can't, you can't, we can't, but they can. You send it up and then they have a special key that turns it off while it's up.
Oh,
And then.
so that's
they
the
can
hole they
open
go
it, and
through.
then they have a second separate special key that can open that door. And you've got to be elevator people to do all this. Not just anybody has those special keys and codes to do that. And then when they open it, it's obviously, yes, a pit that drops down.
okay.
And so that's why we were able to measure the depth and the length and width and everything
Okay.
of the shaft size. And we have yet another meeting with them on the 29th to go over even more. I mean, it's very, very involved. It's not just in and out.
I don't think I want one of those special keys. I don't.
Well, all I remember was years ago at Midwestern, they had one locked out at the top of Killingsworth Hall. And a guy inside working on it, and somebody did something, but he rode that all the way through to the first floor and survived.
Ooh.
I did 6-floor drop, yeah.
All right. All in favor, signify by saying aye.
Aye.
Opposed on the same sign. Motion carries 5-0. Thank you all. I'm going to change our order here just a little bit. Ms. Fiber from Health Department Director is here with us. I asked her to come do an update on the kind of crisis we are into. Thank you, Liz.
You're welcome. So I put some numbers together really quickly, and I apologize for not being here at the beginning of the meeting. But between March 18th and September 30th, we had 1,871 cases. Between October 1st and October 16th, we've had 998 cases, which is 53% of the total cases that we had had between March 18th and September 30th. On Friday, there were 46 individuals in United Regional from Wichita County that were hospitalized because of COVID-19. Total, there were 63 hospitalizations because, as everyone is aware, United Regional covers not only patients from Wichita County, but from many surrounding areas. And so there were 63 patients that were hospitalized for COVID, which represents 25% of the hospital's capacity on Friday. So as of Friday, there were 230 total patients that were hospitalized. And it's estimated that 230 is estimated to be at over 90% of the hospital's total capacity. So they're that close to being at capacity and putting their emergency response pandemic plan in place, which would, for them, mean that they would be shipping those less critical patients out to surrounding hospitals. So while we have more hospital bed capacity in this area, what we don't have are the critical care beds that United Regional has for those individuals who are requiring critical care. And so when we looked at the type of cases just last week, when you combine the contact and close contact case together, that represents 54% of the spread for COVID-19. What we're seeing is that we're having spread from individuals having parties and gatherings in their home and in other places. We're having spread in churches, daycares, and I can't express enough that you as leaders for our community would speak to the public, speak to your constituents, and ask them to please limit the number of gatherings that they're having, and if they're going to have those gatherings, to require masks at those gatherings, including churches. So speak to the leaders in the churches where you attend. We're having a large number of spread in churches from individuals not wearing masks while they're in church. And so the judge had asked me to be here and just provide a short update, and it's a very gloomy update. I know that we had over, I believe, somewhere around 60 cases on Saturday and Sunday combined. So when the numbers come out this afternoon, they're going to be high. We had a lot of cases this weekend. We had a lot when I came in this morning to start pulling those for the day. So
is it 63 number, is that as of Friday or is that as of today?
that's Saturday and
Oh,
Sunday numbers.
Oh, Saturday and
We
Sunday.
had 30 cases over 30 cases on both Saturday and Sunday, and I haven't seen those finalized numbers, but I know both days were over 30.
I'm talking about hospitalization numbers.
That's the 63 is the total hospitalizations, both in Wichita County and out.
But that is as of today?
No, that
Okay.
number is as of Friday.
As of Friday, right.
That's a.
So the number I heard this morning was 41 Wichita County residents in United Regional. And
As of Friday, it was 46, and I haven't received the updated numbers for today.
I don't know where Henry gets his numbers, but I just listened to Henry this morning, he said 41.
I don't know.
But also that that had reached the capacity of the corona patients housing area, and that United Regional had increased bed space up to 60. Just listening to Henry this morning, he said they had to just get on some more beds and make out some more rooms.
They have for their non-critical care patients, they've expanded the floors that they're using, and they're expanding their critical care area into some other areas of the hospital as well.
Lou, we talked about October back several months ago, and everybody was predicting that we were going to have a large flare-up in October. Well, I think that's come true. I mean, I think it's hit us, and it's hit us pretty hard.
Lou, what drives that, in your opinion? Is it just the letting down the guard? That we've done such a better job from March through September, and then we've just quit doing it, or is something else driving it as well?
I think it's a combination of things. I think people have COVID fatigue. They're tired of COVID. They're tired of hearing about it. So they're not wearing their masks. They're not social distancing. They're not doing those things. They're having parties and barbecues and get-togethers. We had an enchilada party that was held, and I believe somewhere between a half and 3/4 of the individuals that attended that one single gathering were positive for COVID. I've also talked to individuals who are contacts to cases for individuals who have been tested, and then they didn't tell the other individuals that had been tested, and they came over to their home and that way. So it's really important, if you're getting tested for COVID, one, to go home and stay home until you get those results. The only caveat to that is if you're having it done for pre-op reasons, and then you're not ill at the time that you're having that testing done. But if you're a contact to a case, if you're symptomatic, you need to have that test done and go home and stay home until those results come in.
Lou, tell the people how you help facilitate that. You give a person who's You give them a caregiver type person from your department that actually calls and checks on them and
So
yeah.
each individual case that comes into the health department is assigned a case manager. They call and verify all the information, ensure that they are a Wichita County resident, and then we go back 7 days to try to make a determination of where they came in contact with COVID. And if we can't, that's where the community spread number comes from. Based on that investigation, we make a determination of what type of spread it is. And then we look at 2 days prior to symptom onset, and if they don't have symptoms, we look at 2 days prior to test date for those that are asymptomatic. And then we do contact tracing from that. So we want to know, were you at work, were you at church, were you at a party, who were you around, did you go to the gym and work out? And based on that information, we determine who those contacts and close contacts are to that individual. And then if it's a non-household contact, those individuals are required to quarantine for 14 days from their last date of contact. For a household contact, their clearance depends on when the case clears.
Yeah, but you do help manage that. I mean, you have somebody that is a case manager and calls. Is it daily that they talk to these individuals daily?
We had been calling them daily because of the sheer number of cases that we're getting in per day. I don't have the number of case managers to continue to call them daily. We're going to call them less frequently, but we will still be in touch with them, and they will have a case manager's number in case any issues arise. But we do ensure that those individuals have access to food. If there are financial issues, we connect those into resources in our community.
I just wanted the people to know that there is a tremendous health department effort behind this, and that they have been working their tails off to try to help us. And I don't think a lot of people even know what they do. And it's not just being ugly and tracking numbers. I mean, they're helping people, and I want to say thank you for that. I mean, that's a lot of work and a lot of management, and takes special people to do that.
Most of our nursing staff have been converted to COVID case managers, so we're not doing any of our preventative health programs that we had been doing prior to COVID. All of those individuals are working almost somewhere between 90 and 100% on COVID-related issues, and I've hired over 24 contractors to help us in this endeavor. It's huge, and those individuals are all working 7 days a week, calling these people. We have people on call on the weekend because we got over 60 cases in this weekend, and had we not had we have a health department staff who acts as the hub for that, and then they assign cases out to case managers that we have on call. And so most individuals are working 7 days a week trying to manage this, and as we get increased numbers, that becomes more difficult, and we have to look at what we're doing and how we're doing that.
I'm going to put my county commissioner shoes back on for a minute and think about the purse strings. Are you tracking your cost? I know that we can get reimbursed, Judge, 80-20? Is it 80-20? Yeah. Are you really keeping an eye on that?
So we are. We're actually, even though we're a city county health district, we are a department of the city of Wichita Falls. So that's all being tracked through there. For all of our case managers and for many of the things, we have a preparedness grant, we got an epidemiology grant, and then there's CARES Act funding. And so we've been using that funding, but there are general revenue dollars that have been from the city that have been utilized for our COVID response.
Okay, that's good.
Everything that we can push to the grants, we push to the grants.
That's awesome that you had enough foresight to get in there and get those grants. That's good.
Lou, where do we go from here?
Home.
Your guess is as good as mine, I understand,
Yeah,
but.
I don't have a crystal ball, and I don't know. I know that we're continuing to see numbers go up across the state of Texas, not just here. You know, I'm hoping that people will see what's happening with our hospitalized, see the number of people that we have positive here, and kind of take a step back and go back to some of those practices that they were doing early on in this, and really limiting the number of places that they're going, and making a personal choice and having some personal responsibility for their actions and where they go, and determining what risk is adequate for their family. Is going to the wedding or the enchilada party worth spending 14 days or more in quarantine? And I think that's the question that we each need to be asking ourselves as we make plans to attend whatever events come up in the next 3 months. So I'm hopeful that our numbers will decline, but I think that we'll continue to see a rise before they do start to go down.
And here we are with the holidays coming up.
Right, and
That's gonna make it more difficult, I would assume.
yeah, and we're all hopeful for a vaccine. There are several vaccines that are in the third phase of testing, and so we're hopeful that sometime before the end of the year or right after the first of the year that we'll have a vaccine out. We do have a plan in place. The health district has a preparedness plan in place for a mass vaccination clinic. We've done those in the past with our flu vaccine, so we've practiced those and we pulled those plans out. We have people looking at those, so.
I still remember the polio effort. Not many people are old enough to remember that, but I still remember the mass deal and they went on for days, people just going through it
So
a long time ago.
we'll have that plan in place and ready to go when we do hear word that vaccine will be available.
Lou, how do you feel about the herd immunity deal? Is there anything to that, or?
There absolutely is.
There is?
Yes, that's what we do with any of our diseases. So whether it's meningococcal disease, whether it's polio, whether it's any measles, mumps, rubella, any of those things that a lot of us that are older had when we were a child, when you talk about measles, mumps, and rubella, that we now have vaccine for. We have individuals who, because of their immune compromised status, can't be vaccinated. And so we depend on enough people to be vaccinated or to have had the disease to limit the amount of spread. And it, in essence, protects those individuals who can't be vaccinated. So if you think about this room and we have, I don't know, say 15 people in here and 2 people can't be vaccinated because of their health status, but the other 12 can, we're in essence protecting those individuals who can't be vaccinated because we're not susceptible to get the disease because we've been vaccinated. So it's something that we see all the time in epidemiology. We depend on that for those individuals who can't be vaccinated, and it works. And so the thing that we don't know about COVID-19 is whether or not it will be like the common cold or whether it will be so people can get the cold over and over again and there's no immunity that's built up to that. So there's currently studies going on to see if people who have had COVID-19 have lasting immunity. We do know we've seen 2 individuals out of Arizona that have been reinfected with COVID. It's a slightly different strain than what they had originally. But, so it's early on. I mean, you're talking about us here locally being 8 months into a pandemic, and there's so much that we know, but there's so much more that we don't know. And the immunity, the long-lasting immunity is something that we don't know and we may not know for some time.
Yeah.
Well, if herd immunity won't work, vaccination won't work. It's basically the same thing. It just depends on how you're building antibodies in both cases.
Yes,
So-
yes and no. So it depends. When you have natural immunity, you've had the disease, and that really depends on how severe your illness was, how long you had it. What we do know is those individuals who have been more severely ill have a longer lasting immunity to COVID-19 when they've done the studies than those individuals who were either asymptomatic or had very mild symptoms at all. They have less immunity. So when you get a vaccine, that's a structured dose in a structured amount that's been tested and proven to show some type of immunity. But it may be like the flu vaccine, which will protect you. It may not stop you from getting the illness, but if you do, the illness will be less severe.
Moving forward, you see us getting our influenza, our flu shot every year, and a COVID shot every year?
I don't know the answer to that. It's conceivable that would be what it is. The fact that it comes from a family of viruses that causes the common cold is a concern for me personally, and I don't have anything to back that up, except when you look at the way that a coronavirus, which causes the common cold, behaves, and we've never been able, or they never have had a vaccine for that. Now, whether they're able to do that or not, but there never has been a vaccine for just a common cold.
Right.
Well, there were things we used to have to take booster shots for.
Yes.
So if you had low immunity that would run out, then you might have to do the vaccine to build your
Well, and
immunity
there's,
back up.
Right,
And I
and
know
there
we're all
are-
speculating because we really don't know, but
and there are some vaccines that it takes more than one dose. For an MMR that a child receives, it's 2 doses before you have full immunity for.
didn't we take several doses of the polio medicine? I was thinking we
Yes,
did.
and it
Yeah.
still is a multi-dose.
Yeah,
So, and most of the vaccines that are in trials do require 2 vaccinations, some of them usually anywhere from 24 to 30 days apart.
I want y'all to remember though, the polio deal was on a cube of sugar and that's a lot better than a needle. So.
It's not anymore.
Doggone it.
Well, so Lou, do we think that we're dealing here, I mean, the perception is that we deal with multiple strains of this virus?
Sure,
that
yeah.
I think that's a possibility.
And,
A virus will do what it has to do to survive.
I see. So,
So Lou, are you comfortable talking at all about what Phyllis was relating on the Friday call about the impact that COVID patients are having at the hospital for all critical care? So if we have too many folks in the hospital with COVID, when somebody has a heart attack, that has an impact. It's not just impacting the COVID folks.
Right,
Are you
it's
comfortable
all
addressing
those.
that so folks
Um,
understand?
It's all, so if I'm having a heart attack and I go into the emergency room, if all the critical care beds are filled because of a surge of COVID and a mixture of whatever else, and they've reached their critical care capacity, then they may not have that critical care bed for me. They may have to look at moving individuals out and making choices from that. And that, how they would do that is really a question for Phyllis. But it's not the critical, the state that the hospital is in is not just about COVID patients. It's about care for all other patients that walk through the door. And as Phyllis said on the call Friday, they never want anyone to delay care. They want them to get in and get to the emergency room and get the care that they need. But it is an issue, and it's something that we as a community have to think about. That's why it's so important for us individually to make good choices about how we behave when we go out in the public, and wearing masks is one of those.
I want to make sure that the people understand that if you walk into the emergency room with a heart attack and all the critical beds are full, the United Regional will work on you in the hall. They're not going to let you die because they don't have a bed for you. They're wonderfully professional people, and they're not going to give.
They have a plan and they're prepared for this.
Absolutely. I mean, you're going to get the care you need, but you might not be stuck in a private room or something. You may
Well, they
be.
may not have the state-of-the-art equipment to deal with you because it's
Exactly.
being used for other purposes in the hospital.
Right.
That's the bigger issue.
Well, the third issue in that is having to do with staff.
Right, so there,
Yep.
you know, one of the things that Phyllis said on Friday was that they're experiencing staffing shortage, especially in those areas for critical care, because many of their staff, as we see cases increase, those staff will be either household contacts to a case or non-household contacts to a case. Now, we are working closely with them and their quarantine guidelines. The CDC does allow some different guidelines for medical facilities, and so we are looking at those standards today across the board with healthcare, because we're not only seeing cases in our hospitals, but we're seeing them in our nursing homes and in our medical facilities where staffing is just as critical.
Yeah.
I talked to a lady whose son is older that has medical conditions in a nursing home. The nursing homes have received directing from Health and Human Services to open up and allow limited visitation, and she's very concerned because 2 of their newer patients came in, were not positive with COVID, but in their routine testing since their admission are both positive. And she's very afraid of what this is going to bring in. But when I talked to the director at that facility, he says, I have no choice. I have this directive that from Health and Human Services says I must start allowing limited visitation under these guidelines. So some, one size does not fit all.
That's correct.
Is our biggest problem, and that's what's coming out of the various levels of government that have decided they can run things better than we can. So, when the governor came out with his order and gave county judges the authority to open the bars that weren't open yet, but then he also opened it for any bars with outdoor stuff. There's no limit. They're supposed to have social distancing and wear masks unless seated at a table drinking something. That is generally not the behavior we go to a bar to sit by ourselves. That just isn't it. And, so.
There's a good country song in there somewhere. There's a good country song in there somewhere.
Yeah, I'm sure there is. And if there's a train, we know we got it. So, at any rate.
Gotta have a
Well,
pickup truck.
and Lou, is there, and it's my perception only, but has there been more hospitalization or stronger reactions to the ones that have been infected lately that seem to be sicker than what we saw throughout the summertime?
So on Friday, we had 46 hospitalizations from Wichita County, which was our highest single-day total for number of hospitalizations since we began on March 18th. So that's higher than any other day. And what Phyllis said is these patients are much, much sicker than what they saw back during the spring and summer.
And what drives that? What makes that be the case? Why would they be sicker?
I can't, that's not a question I can't answer.
Well, you could with Senator Washington, D.C.
Well, it appeared that
It is
way to
curious,
me, that
though.
more
I mean,
people are
yeah.
going to the hospital or having to be hospitalized in
And
this brief period here that we've experienced this uptick.
Well, and I don't know, what I haven't done is run a percent, so it's the percent of total cases that we have. So we have more cases now than we had over the summer, so I don't know whether percent-wise that we're actually seeing
Okay.
more of we're seeing more numbers, but we're also seeing an increased number in cases.
Gotcha.
So we haven't looked at, say on June 1st, we had 20 that were hospitalized, but we had so many active cases. So
Right.
what is that, the hospitalization percent based on active cases? And I haven't run that number.
The
And
other
that's
thing-
really what you'd have to look at to know. And the question about why they're sicker may be something to ask a physician or a medical professional at the hospital. I just don't have any of the patient information other than the numbers that come out,
Okay.
so I don't know.
But it could be, as you said earlier, a virus will do what a virus can do to stay alive, and so therefore, is it, strengthening and they're becoming more aggressive when someone does contract it?
How can you tell if it's mutated or not?
People by far way smarter than I am who when they do the PCR testing, they run analytics on the strain of virus, much like they do with any other Shigella or Salmonella, and they know what strain that is.
I'd encourage everybody to look at your website on Friday afternoons when you publish the new charts. The graphics are quite good. Looking at the charts Friday, when everything is just going along like a heartbeat and all of a sudden off the page.
And I really
That's
have
the
to
telling.
thank Amy Fagan for that. She's been kind of the hub for our COVID response. And so she's responsible for all those charts and graphs and all the data that's put together. And so that's a lot of work, and she does a great job at it.
Yeah. Those are very helpful when you see it in graphic format. And you can see exactly where we are as compared.
Certainly
So
makes a
that
statement.
spike from on Friday is very telling.
And we're not doing anything to flatten the curve right now, are we? We're actually human behavior is actually bad right now. So it could even get worse.
everyone needs to be making good choices about our own behaviors and for our family and for our community.
Thank you very much.
Thank you for all the hard work. We know what you're going through, or we don't know what
Actually,
you're
we
going
don't,
through, but
yeah.
we know it's tedious and a lot of work going into it.
Well, and I just want to thank y'all for the support that you as the county leaders give us at the health department. I've heard so many horror stories from my counterparts across the state where they don't have support from their leadership, and it really makes a huge difference. So that means a lot to know that y'all are all behind us and doing what you can to help us as we move through this. So thank you.
Okay.
Appreciate you. Thank you for coming this morning.
Thank you,
Would you
Boo.
send us a copy of that or send it to me and I'll share it, so.
Actually, that's just my handwritten
Okay.
but I,
You don't need another report, Craig. We'll look at Fridays like on your website
Okay.
and use that.
all right,
Okay, thank you.
thank you.
Thanks, Louis.
Right. All is understandable, and those non-believers will still be non-believers. So, all right, item number 4 is to receive an update on the law enforcement center project.
About where we were this time last week, still in the process of moving in, getting bugs worked out. Our biggest hurdle yet, we're still working on, and I wish George was still here, I'd ask him again. Our radio connection between this building and the new building. We bought brand new equipment, and the brand new equipment is not functioning properly.
Friday at 5:20 or so,
Yeah.
he said they got internet out there.
Well, they've had internet, but it's limited.
Oh,
I don't,
something
I
different.
talked to George the first thing this morning, and we were not fully functioning. So that's our biggest hurdle to overcome at this point.
Did he say it was a radio problem? Because they replaced the radio.
All he said is he was going up to the 4th floor on this building to work on it, but we did not have fiber lit yet, so down. So I didn't get into all the gory details, but
Yes.
I know he's on top of it, and our staff and subcontractors are working diligently to get everything up and operational. But other than that, it's looking good out there. They've got most of the carpet in the hallways now, and baseboards put on, and it's starting to look finished now. So most of the punch list is complete. Do we have a time when we're going to walk?
They have not, we asked them to get it complete before we walk.
So
I'm
just,
gonna have to spend 5 days walking it.
I want to brag on Harper Perkins for just 1 minute. Walking the punch list with them was, I've walked with Matt several times, but walking with Matt and Glenda on this project, they literally tested everything. Every socket on the wall, every light switch, everything, the door pulls, make sure that the doors were closing at the right rate of speed, they weren't too heavy. Looked at every wall for paint and finish, drywall corners. Glenda is evil on drywall corners. If they're not perfectly square and even and nice and neat, do it again. Do it again. If a tile was not perfectly flat, put an X on it, do it again. So I want to commend them. 595 or 555, so 500 and some odd items that were punched just on the interior of the A side.
But I mean,
Does it
that
Yates
doesn't
litigate?
mean, that doesn't mean we've got some bad work.
No, the work, if you walk in the building and you see it, the quality is really good.
I agree.
But they're going through with the magnifying glass and the fine
It's
tooth
just the
comb.
scale
and
creates.
making
the-
sure that we are getting the value that we expect, that everything is exactly as we
So
specified.
does Yates Littleton walk with you on that punch list?
They did not when we walked it the other day. I mean,
I've always done that for years, walk the punch list, but I always had the contractor with me. And
I've
got
done
their
it
buy-in and
both
let them take their notes, and it was really good communication for the contractor. So you might include them in your next walkthrough,
Mark, whatever came of
We
the,
give them that opportunity, they choose not.
not to do it.
the paint, you were not satisfied with the
with the
lobby?
lobby, I was told they were supposed to repaint it over this past weekend.
Oh,
I have
I
not
didn't talk
checked
to them
on
this
that.
morning, so I don't know if they had it done this weekend or not.
But it seems like every time I've been exposed to these crews out there, they diligently, doing their job. I mean, seem like they're tremendous
No,
craftsmen.
I have no concerns with the quality of work. It's just, I want y'all to know
Sure.
to the level of detail that Glenda and Matt put into that punch list is.
Well, you can put it like this, they're nitpicking for
They
us.
are, and that's what you want. You do not want to
Sure.
leave any stone
They're
unturned.
nitpicking for us.
Well, what's a good thing, Yates has consistently said about the subcontractors that work for them from this area. They are amazed at quality of work and work ethic.
Yeah, we did have, on a side note, we did have one of our subcontractors test positive for COVID. It was isolated very quickly. We worked with both Yates, Littleton, and our HR department and health department to get it isolated and narrowed down, and it's not a problem. So.
So if you walk downstairs, it's like a ghost town. There's, I think, 3 desks. I think Jamie's there, Robin's still there, Jill's still there,
And they'll be
and
there,
everything else is gone.
they'll be there until the
Internet's fixed.
internet problem is solved.
Yeah.
Again, we do have internet in the building.
I didn't look at records. Is records still there, or is it gone?
No, records is gone as of, was it Thursday or Friday when we finally got T-Lets up?
Thursday,
Yes.
Friday.
Go ahead, you know,
Was it
you know better than I do.
I think
Thursday.
it was Thursday.
My days are running together up there. We do so many moving parts, but yeah, T-Lets was installed after we rescheduled them about 20 times.
I was talking to Robert about the, what do you call it, evidence.
Yeah,
That is going to be a major
major
undertaking. Major. They've got like 9 different storage facilities in this courthouse.
That's Robert Penaluna for the most
Yeah.
part.
That's exactly right. And he knows, and there's logged, and I mean, you ask him for something, he can go get it. But moving all that stuff from here to there, that's gonna be a job.
Yeah, it's,
Have to be secure too.
Yeah, it has to be secure. I don't think they can use inmates to do that.
no, it'll all be staff. They have a plan. Secondary to all of that is security in this building. We're taking some steps to both remedy fire panels, security panels.
Yeah.
Make sure that we can get staff in and out of this building on the weekend, so. Lot of moving parts, not only at that building, but in this building and the courthouse annex as well, as a result of the move, so.
It's a lot of work.
Yeah, a lot of coordination effort between a lot of different departments and people right now. But, yeah, our staff's doing a great job.
Thanks, sir. Okay. We're down to public comments. Anyone in the audience have anything? Okay. Mr. Beecham,
I don't have anything to say.
Commissioner Harvey.
Senior Citizens Fish Fry was a big hit. We didn't pre-sell a lot of tickets, and I think it was, I was afraid of the COVID virus. But the way we did it was drive-through. Nobody got out of their car. The people that were taking tickets and money were masked and gloved. the Redneck Culinary Academy served hot food. We cooked on the fly. We didn't pre-cook anything. And the mayor told me, he said, Lee, I left the house and I pulled in that line. I thought, oh my word, I'm going to be here an hour. He said, from the time I left my house to the time I was back in my living room, 15 minutes. With hot food. It was really good. We didn't do drinks. You know, we're worried about spilling and trying to coordinate. So we did the fish fries, hush puppies, coleslaw, and tartar sauce. And we pre-packaged everything. Friday we went up and packaged all of our tartar sauce in these little squats, lids for them. We were really organized, and it went really well enough that we ran out of fish twice. We had 30 pounds at the center that we got and thawed out. But anyway, I think we sold just under 400, which we had only sold tickets for about 200.
And to answer your question, we didn't have any loaves, so we didn't run out of them.
Come on, guys.
So anyway, it was really good. It was a great support from our community. Thanks to the Redneck Culinary Academy. Those guys do a great job. They work hard. I think I've reached out to CASA. We're supposed to cook for them on Thursday, the 22nd, but I can't get them to reply back. They called and had me put the date in, block the date, but they have a new leader, James Bodlin, I believe it is. And I've reached out to him and I haven't heard back from him. So I mean, it's kind of cutting it close. We gotta order the food today if we're gonna get it in for Wednesday and get it thawed out and cook on Thursday. So I don't know if they've decided to cancel because of the flare up, and I just can't get a response back to them. So I'll work on that and see what I can figure out. If I have to call somebody different, I will. But got to take care of that today if we're going to have food for it. Really, that's all I can think of right now.
Okay, thank you. Commissioner Ballmer.
Well, what a devastating report from the health department. I mean, this was not where we wanted to be this time of year. And I'm just sitting here thinking, as Lee's giving his report, and what a great event it was, but can we really do those things?
Well, the way we did it, I think we were safe.
Yeah, I have no qualms about
What's the
that.
mass discipline among the cooks? What's the mass discipline?
There's just,
Say that again.
Mass discipline among your cooks.
Some guys wore them, some guys didn't.
Okay, they're preparing food, that's not even a,
Now, the guys doing the food, they had them on, but the runners that were running back and forth with the trays of food, they didn't wear them.
I don't know what we gotta do to head this thing off, but the longer it drags on, the more of our nonprofits are gonna suffer from not being able to do fundraisers. They're already suffering.
Yes.
And I don't know, this is really a tough deal. And those nonprofits do so doggone much in our community.
Yeah, they do. CASA is very, very important.
If they weren't taking care of it.
As the county.
I always tell everybody, I said, since I've been on this court, I have come to a new appreciation of what our nonprofits do, that we would have to assume that responsibility if they weren't doing it. And boy, it just hurts me to see these folks missing these fundraisers.
Yeah, I think about Friendly Door, Barry,
I know.
they're just, they're funk and
I'm telling
able
you,
to
these
do
folks are in
that.
trouble. And,
Well, I have a question. Judge Gossam, if we didn't have CASA here in Wichita County, what do you think it would cost the taxpayers in Wichita County to perform that duty? A budget, an annual budget?
probably half a million more.
a lot.
A lot.
But you'd have to look at but you still gotta have people you can appoint, and that's the problem, is having that resource available to the courts. And if you're talking about, like during now, this is one of the problems, is organizations that are run by volunteers, can't find the volunteers, they're afraid to get out because they're journaling people.
But what if we had to pay those advocates
If you had to pay those, but I'm just saying, you're still gonna have to find the person to do that job
and pay them?
and pay them.
That's extremely expensive. And
And some of it you wouldn't do.
exactly. Services would diminish and the cost would go up, and they perform a very, very important function
That's why I try to
for our
work with
children.
groups, and we haven't gotten done with the legislature, but on that family support fee that is part of your $1.50 on a license tag, to get that where that would be easier to get that to those groups, would sure help. But
Well, if this goes on, guys, I see lots of problems out on the horizon we're not even thinking about right now. If we drag on for another 6 months, this is gonna get tough on.
you know, it's gonna be interesting, you know, the governor sounded good maybe a few months ago, but he suspended, if your licenses were due to renew, it wasn't gonna be until 60 days after he took away the disaster declaration. Well, generally speaking, those are $60 on up. Well, are you gonna get into now it's 2 years? They have to pay at one time? There are a lot of families that might not be affordable. So are they gonna waive that or not?
Judge, there's just gonna be a lot of things come due that have been pushed along, and it's gonna create some major problems that people are not even thinking about.
Well, the people that because of evictions didn't think they had to pay their rent.
Yeah,
Not doing evictions, but you still owe your rent, you
At
still owe
some
your
point,
loan
you're
payment.
gonna have to pay it.
You know, the money they've received in unemployment and in the additional money, that's all taxable.
And if you think, paying 1 month's rent stuff, wait till you owe 3.
Yeah.
Then it's really tough. It's a life-changing experience. Well, we're all frustrated because we can't do anything. I mean, we're doers. We wanna fix it, you know, and you just can't, you know, pass a resolution in this court that's gonna take it away. And to me, that's just frustrating. I don't like to deal like that. I wanna be able to, let's go fix it, and we can't do that.
we can't do it.
And,
It's like what I said to Senator Corn, quit paying people to stay home. Pay them extra when they get their job. Give them 3 months of extra money to help them catch up. But quit this deal, because we've got a lot of help wanted signs.
yeah, we're creating a bad situation,
Yeah.
long term.
Well, we didn't create it, but
No,
we're gonna live with it.
yeah.
Okay, Commissioner Watts.
We are still on Lock Road, laying in our riprap. Lee, do you have any idea of the cost of that compost, or not compost, mulch, I guess?
Mulch?
How that runs,
Spray on
a square yard or square foot, or,
No, but I have a number that we can call and talk to Mr. Spraggin.
could you send me his contact?
Sure.
I may just.
Help me with his first name?
Lance.
Lance.
Yeah.
Lance.
And,
It's done on, I think, a per square foot deal, or might be square yard, I'm not sure.
yes, yeah, and
He did our gun range for us.
at the
He's been in
landfill.
that business for years. That worked with TxDOT a lot, did a bunch of projects.
But that's coming along, we've been able to catch up on some other, items. We've completely used our fill out there, and the Locks generously donated us some more fill to, help with this project, and that's going to get us maybe not complete, but at least way down the road, and we've been able to, seems like we've had a year of special projects that have been, something else. I mean, from the Grand Canyon to creek cleaning to bar ditch. We've got bar ditches that are 6 inches from the shoulder of the road that are over my head tall.
It's not good,
Not good at all.
especially with the wild hog population.
That's what we're out there working on, and what was a curse with that tremendous riprap that across many, many years, they allowed to come in on Old Lake Road out there. We've been able to diminish those piles tremendously and put them in there to backfill over the top of and create a better ditch that maybe has some riprap in it that won't wash. So anyway, that's Precinct 4 doing. I'm glad to know, and I'm glad the flag scenario came up. James Gowan had called me last week after that big wind. And I said, James, we just got flags. it was to the point, and I mentioned it last time to y'all, before, the last time we got flags, I was ready to give my flagpole away. I just couldn't keep, of course, we sat in the middle of, you know, a windy area right there, and nothing to block that wind or,
Now
but.
you're
Well, it's Arbor Day,
now
plant some
you're
trees.
surrounded with windmills.
Yeah, yeah, that's right, so, I'm anxious to get maybe a better grade that will at least give us.
Take them down during that time.
Well, should you, I mean, is that, what is the?
If it's not lit at night, you're not supposed to fly it.
It is lit,
Okay.
mine are lit.
But maybe during those high winds, yeah, take it down.
Take it down.
You'll get calls about it, where's the flag? You say it's in my back seat, I save it from the wind.
Well, and you know, I get the advice or, and it's not really criticism, they are disappointed to see trouble with the flags, but they're people that know about what they should look like and should be, you know, and typically that's something that don't even catch my eye, to tell you the truth, you know. I mean, I could tell if it's a smeared to pieces.
So I hope that you're saving your old flags,
Yes.
and we can give them to the Boy Scouts when they do their flag burning
Yes, and
ceremony.
actually the Lions Club in Electra does that, Lee, too, so
Okay.
they've helped us with that.
They'll have to get a burn permit. All right, anything else?
That's it, Judge.
Only thing I had was, Tuesday will be the MAC, Military Affairs Committee meeting will meet at 2 p.m. Tuesday, by Zoom. And then Wednesday, morning at, 10:30 is bail bond board meeting. We're going to have a couple items on that agenda that will be here, but it will be short. We'll practice distancing for that.
What are the voting hours this week? 7 to 7? I can't remember.
I can't either.
I know they were actually open on Sunday, noon to 5, I believe, yesterday.
Well,
According to Lori, it's been steady at all locations. I think Owl Park won over the weekend, or yesterday.
Somebody said that they didn't think there's gonna be any voters left for election day. Everybody's voting early.
That is curious, isn't it?
The other thing, some people said, well, how come she didn't know to order more ballot material and more envelopes? She did order more of those to start with. But we also threw in a special election, and that depleted resources. That stuff's on order, they've been printing, they're gonna get those out as soon as they can. But,
And another one to come.
you know, but then there's gonna be another election, December 19th.
Yep.
And,
I bet there's not gonna be much of a turnout for that.
well, but she's gonna order it like there is, and then.
Everybody that ordered a ballot for this one gets a mail-in ballot for that one.
Yeah.
the, Judge, on the bail bonds board meeting, I was, wondering, does Curtis or the auditors group not do any, validation or maybe security paper? How are we how do we tax ourselves to, keep abreast of Jeff Watts is going to make bond for people and that my lending limit is X? Who keeps up with that?
The bond office does, and we're still revising that information, but that's who's responsible for it. And then when the collateral and all is put up at this property, that's all researched by the civil division before it's accepted. If there
So-
are any liens or anything against it, and it is insured and maintained.
So the property, we actually, Tracy, receive a lien on that? When, if I put up a $500,000 property for a bond, do we secure that somehow?
We do, it's not really, I don't consider it a lien, but there's just some sort of notice that is part of the filing that indicates that this is property that's pledged to us collateral, for lack of a better word.
So the title policy would pick up on that during the
Yes,
research?
so, right, so,
That's the
so
language.
it would be a part of the record relating to the real property.
Okay.
Just to make sure. Now, and you know, a lot of folks though, use the insurance companies. Some of the bonding companies are backed by an insurance company, and so their bonds are typically, only limited by that amount.
Okay.
And of course, attorneys can make any kind of bond.
The sureties put up $50,000 cash deposit to the treasurer's office. And we are doing a better job on attorneys to make sure they have the collateral to go with what they wanted. For a while, that wasn't monitored, but that's being done now. And our quitclaim deeds, what I'm thinking I see on property when it's put up so that we can execute it if they are going to default. Does that sound right?
No, that does not sound right to me.
Okay. But it's not a big deal once we, you know, it's fairly straightforward if we are to take property.
Would that be a sheriff's lien or a sheriff's deed? Because I've seen that.
I don't believe so. The sheriff's deed would be, for instance, when property is sold on the courthouse steps, tax property that's been levied on, you know, credible on taxes and that kind of thing. So that's when the sheriff can sign a deed making the transfer of those
And
properties.
Tracy, have you looked at this issue within Odyssey? Are you familiar with the work we still need to do, I guess, to have a clean, legitimate list? And is there a protocol or process that should go in? One of our dilemmas that's hurt us is that Nancy could be 7 different companies. And even though they all tie to Nancy, I don't know that we ever had a protocol to tie them all to Nancy. So we've got ABC, CBS, XYZ, out in the field, whatever you want to call the name of the company, all under one affiliate, but they're making, and I don't understand the nature of why people would do that. It may give them more lending ability or bonding capabilities. But I just wondered, moving forward, is there a way to make a master and they all be subservient under the master account holder? For example, if Tracy Jennings Insurance Company bonded 20 individuals in Wichita County, how do we verify that Tracy, she has $1 million lending limit, but we go to checking and we're $5 million into Tracy backing bonding companies in Wichita County? What is there processes or protocols of others use to validate or substantiate how this is best done?
I know that there are processes. I know that prior to Tyler, prior to Odyssey, I know that there had to be protocols in place. And then, of course, you know, the sheriff is the one who kind of makes some initial determinations about that. And that's why it makes sense for bond management to be part of that.
I see.
I absolutely want to represent to you that I believe there's going to be a day, probably not in my lifetime, when Odyssey and Tyler Technologies are going to be able to do that for you.
Okay.
It is not today. It will not be next week. I don't think it'll be this year. But I'm telling you, I know in bond management they're working hard for that. I'm not going to promise you that because we're still having issues with the merge. And so we have folks who've made these bonds that are still hanging out there, even though we're making bonds daily. Folks are getting off bonds daily. I mean, it is a constantly moving target.
Right.
So I absolutely do not want to make you that kind of promise. But in theory, absolutely. In my mind, that's a push of one button,
Okay.
and we get a report. That's not the world we're living in today.
Okay.
No, it sure isn't.
Anything else? All right, it is 11:30 and we're Friday.